healthcare workers in World Cup host cities, including here in Toronto, say they're concerned an already strained healthcare system could buckle if a sudden surge slams emergency departments during the tournament.
It all comes as city councillors crunch the numbers on the cost. CTV's Natalie Johnson is live tonight at City Hall with more. Natalie.
Well, Michelle, less than 5 months to go now until the city hosts its 6 World Cup games. The price tag on Toronto's hosting duties remains at $380 million, but one ER doctor is sounding the alarm on what could be a costly concern. As Toronto prepares to welcome the world for FIFA soccer this summer, City Hall is charged with containing the costs.
The federal government and the provincial government have all agreed they want to participate. I would really like both levels of government to sign the checks.
The big bill holding steady at $380 million. City funding pegged at $179 million through reserves, hotel tax, commercial rights sales, and rental fees.
The City of Toronto has a structural deficit. There will be a windfall from FIFA, and it's not going to be coming to the City of Toronto, but it's going to be costing the City of Toronto an incredible amount to host this event. So we're hoping that our partners and other orders of government will continue to be at the table with us and really taking a serious look about their financial responsibilities as well as things under their purview.
Healthcare near the top of that list. In an editorial published today in the Canadian Medical Association Journal, Toronto emergency physician Dr. Catherine Varner warns that for hospitals here, quote, being in a constant state of surge capacity is actually the norm. Concerned about mounting pressure on Ontario's healthcare system as some 300,000 visitors descend on the city for the massive event.
We see in any number of sporting events or mass gathering events where you'll have more trauma in hospital as well as more alcohol or substance-related visits to emergency department utilization. Those are things we saw in Game 1 and Game 7, of course, in downtown Toronto when I was working. Saw a lot of head injuries related to booze-related incidents, and not so much in the stadiums themselves, but what's happening in the city as people are celebrating.
We're doing everything we can to enhance the healthcare system. You talk to our finance minister, every time I see him, first words out of his mouth, do you know how much we're spending on healthcare? And I say, well, we're investing in healthcare.
After years of planning for FIFA, Toronto's World Cup year is here. The question is whether the city can come away with a win. In another assessment of possible strain to the healthcare system created by the World Cup, Public Health Ontario is warning that measles, COVID-19, and foodborne illnesses pose moderate risks during the games. Reporting live at City Hall, I'm Natalie Johnson. Michelle, over to you.
Thank you, Natalie.